Hi, my name is Dr. Karen Breen and I am a consultant haematologist. My specialist interest area is within hemostasis and thrombosis, which is a complicated term for bleeding and clotting conditions. Ultimately, I suppose it's always been a drive to help people and to try and improve underlying conditions to try and figure out what's going on in the human body and what are the ways that we can improve that condition. So, I mean, I think even from being a child back as far as I can remember, I was always fascinated by the human body. And, I was your typical child, always dressing up in the doctor's outfit. My mum was a nurse, so I think that's probably influenced me along the way. And certainly throughout my school years, that drive to become a doctor was sort of really facilitated by some great teachers who improved my interest in science and I guess just reinforced my interest in becoming a doctor. So yeah, I think it really has been sort of a drive to help people and fascination with the human body, essentially. So why did I choose to become a hematologist? I think along the way in your undergraduate years, particularly, you're often heavily influenced by the people that you meet. And certainly as an undergraduate, I met some very proud and really driven hematologists who were passionate about their career. They took an interest in us as students, and I found the breadth of hematology really interesting. It's a particular specialty that you can become involved in both sort of treating patients at the bedside and then bringing back investigations to the laboratory. So you have a really firm understanding of the disease processes, the tests that are involved in the investigations, because you can understand exactly what happens in the laboratory and literally bring that back to the bedside. So I think certainly for me, hematology was one of those really interesting specialties. And then in terms of my particular sub-specialist area of hemostasis and thrombosis, it's a real problem solving area. You can really sort of delve into many details in the laboratory aspect and the diagnosis and bring that right back to the patient. I think that the process of the clotting system in and of itself is really interesting and really fascinating. And I'm lucky enough to work in institutions where we are cross-cutting across many disciplines. We get to meet lots of really great colleagues and take care of patients who have really complex conditions sometimes. So for me, it's a constantly evolving field. There's lots of opportunities to kind of improve care in this area. So, while my interest continues, I just really particularly enjoy hematology and all that it offers me as a clinician. So I think what I find most rewarding about my job is the ability to help patients. I mean, we understand that unfortunately in some cases patients don't always get better, but it's being able to communicate to patients and discuss what their options are to try and reassure them with regards to their condition. And certainly when you see a patient who's been really unwell come back to see you in clinic and sometimes bounce through the door because they feel so much better, that's incredibly rewarding. But I really just enjoy the opportunity to meet people, to talk to them about what the underlying issue is, what their prognosis is, how we're going to treat them, and what their expectations are. And, meeting with their families, because clearly it's often a really stressful in time for patients when they're unwell. So I think for me, it's just an overall opportunity to try and help patients get better and further understand their condition. So I would hope that my patients value the fact that I'm a good listener. I like to listen in detail to what the patient's symptoms are, what their concerns are, And I would hope that I'm also a really good communicator, that I'm able to discuss with them and meet their expectations in terms of, what is the underlying illness, what are the expectations for their treatment, and, what's their prognosis essentially. So I think overall, I would hope that certainly my skills as a communicator would come across. And I suppose, so what do I value from patients is that constant reinforcement of keeping us as clinicians grounded. I think, patients remind us that often that, we don't always know everything about their conditions sometimes, and that often, the value comes from exploring other options. And, I think you have to be able to discuss all the available options to patients, and put everything on the table, and that they as the individual have to try and accept what you're offering as a clinician. But I guess it's just, that certainly we have to value feedback from patients, and just remember that, at the end of the day, there's an individual who has often a significant concern, and, I would hope that they value from us that we're able to discuss that in detail with them, and help them get better going forward. That's a good question. I think I would probably say if you want to get something done, ask a busy person. So, for me, it's just that thing around, just get it done. Don't put it off, because life is short, and just, grab that opportunity to get everything completed as soon as you can.